my name is Lori. I'm a registered nurse here at Atrium Health in Kings Mountain Hospital. I am in the middle of doing a college debate on House Bill 401, Enact Medical Cannabis Act. I am personally for this because it is an alternative medication for chronic illnesses, and it also protects those who are taking care of the patient who are taking the medical marijuana. That, say if somebody gets arrested and they have the medical marijuana on them, the caregiver and the patient are protected in this bill. I think that the only thing I have that I do not approve of that puts me against passing this bill would be the pediatric population and how there's a lack of research. And what are the repercussions of taking medical marijuana long term? The House bill was filed initially on March 20th, 2019 for the first reading, and it passed. There's only been one addition to the bill since then. It has not been brought back up to the board for General Assembly or for any other voting yet. Like I said, this House bill is for those with chronic, lifelong, debilitating illnesses, including cancer, HIV, AIDS, hypertension, severe migraines, gastrointestinal disorders, Crohn's disease, Tourette's, and sleep apnea. These are just to name a few that are listed. The cannabis can help illnesses by helping control chronic pain, and it controls muscle spasms and nausea. There's 3 routes of administration for medical marijuana. It is inhalation, ingestion, or by topical application. Like I said earlier about the inhalation, is there any long-term effects to the lungs from inhaling the medical marijuana? The cannabis plant, the marijuana, is broke down into 2 forms. There is the plant that contains the THC, which is a hypnotic property of the plant. This medication, the THC, can cause a mind high, which produces an energetic, uplifting, and creative side effect. And then there's the body high, which is more of a sedated and relaxing, and mentally relaxes the brain. So it's kind of a combination of the two, the THC and the CBD, that the medical provider can provide due to different strands of the marijuana. There is also ways that the medical marijuana helps patients with PTSD. And being an American, I'm all for anything that could help veterans when they return from war or anything that they have seen with the PTSD. And I also think that with everything going on right now in today's society, with the COVID crisis going on, the rioting, I think this would also be beneficial for some of the frontline folks. And I'm not saying that the medical staff or the police officers or anything else should report to work so quote high from smoking marijuana, but I think that I know several staff that I work with who take medication to sleep, and they take medication for depression, and they take medication for several other chronic illnesses, that I feel that if they were to have something that would relax them to help them sleep better at night would be more beneficial than taking narcotics and benzos and different things like that for their chronic conditions. Because I also know that a lot of these folks like to drink, and when you start mixing alcohol on top of the other medications, it can have a downward spiral effect, whereas the medical marijuana would not have that effect. Also, medical marijuana has been used for well over 2,000 years. It has been dated back to 790 BC, so that's pretty impressive to me that even back then people were using it for their chronic illnesses. So yes, I am all for passing the House Bill 401, Enact Medical Cannabis.